Good day, Ma'am Lori. My name is Marjorie and Dela Rosa from BSN1-B, and in this video, I'll be performing the proper procedure on post-mortem care. So death is one of two aspects of life that will happen to everyone, whether the death is sudden and unexpected or ongoing and expected. Nurses should provide information and help to address the impact of death on the dying and to the family. So the purpose of the post-mortem care is to prepare the body for the morgue, to prevent discoloration or deformity of the body, and to protect the body from post-mortem discharge. So aside from knowing the purpose of this procedure, it is also important to remember to respect the dead body, to avoid unnecessary exposure and irrelevant conversation. The body should be identified properly, and clothing, jewelry, and other valuables or belongings must be kept and cared for properly.
So here are the equipments that I'll be using. First is the receipt of valuables, and then we have the cotton balls, and then the wipes, the Lysol 2% Lysol solution, gloves, the tie for the head and the feet, the surgical net, hair net, the forceps, and that's it. So now I'll have a quick hand wash, then go to the patient's room. So after washing the hands and assembling the equipments, enter the patient's room, provide privacy by closing the door, and then set aside your equipments in the bedside table of the patient. Now, see the family of the patient in the room and provide comfort. Explain the procedure that you're going to be doing.
Hi ma'am, ako po si Marjorie and Dela Rosa. Student nurse po ako dito. I'm very sorry for your loss po ma'am. So bali ngayon po ang gagawin ko is magpo-postmortem care na po kami, ako. And so ngayon po, lilinisan ko po si ma'am, tapos tatanggalin ko pa lang ang jewelry niya. So bibigay ko po sa iyo later para maano na po namin siya, malinis na po, tapos mapadala na po sa morgue. Okay po? Okay. Sige, ma'am. Kunin ko na po yung mga ano niyo, ma'am, ha? Sige.
Remove the jewelry and return all valuables to the relative and have them sign the receipt of valuables. After doing so, transfer or guide the relative to another room before beginning to do the procedure.
Ma'am, ito na po yung ano niya, yung mga items niya po. Tapos, ma'am, pakisign na lang po dito para na official niyo po na nakuha. Thank you, ma'am. Ma'am, bali, transfer ka po muna namin sa isang room po, ha? Para malinisan po namin si client muna. Okay po? Okay. Okay, ma'am. Dito lang po, ma'am.
Go back to the patient and provide privacy before beginning the procedure. So the first step is to put on protective equipment. In this scenario, I'll be putting on gloves.
The gloves.
In this step, I will be removing all the covers except the bottom sheet and the top sheet. and remove the oxygen tube of the patient if there is any, and then remove the pillow of the patient because the patient should be lying straight. And now, place the patient in a dorsal recumbent position and observe proper draping. And now apply a tie around the anterior head to keep the mouth closed. And then make sure to close the eyes of the patient by applying slight pressure for 3 to 5 minutes. And then pack ears, nose, rectum, and vagina with cotton balls.
Next na po is
And now I'll be removing the soiled dressing and drains and replace them with new ones. Also remove all appliances, catheter, drainage tubing, and venoclisis seats, etc. if there is any. Remove extra bed linen and or blanket and leave one sheet to cover the body. Now, bath the body using the 2% Lysol solution to rinse.
Next.
Tie the legs together in place. Then place hands across the chest. A diaper or an incubad is applied under the patient to observe any leaking bodily fluids. This is optional. Place one identification card before wrapping the patient. This includes the name, date, and time of the expiration of the patient. Afterwards, wrap the patient with sheet and pin securely. Pin another ID card outside the chest area after wrapping the patient and call male attendant to secure stretcher to carry the body to the morgue. So after caring for the deceased and transferring them into the morgue, we can start cleaning. It is important to discard all the soiled items that was used. So especially the gloves that was used to clean and to prepare the patient. And so is the wipes that was used to clean the patient. And all the bed linens, the soiled bed linens. It is also important to disinfect the forceps that was used and the most important thing is to wash your hands after. So after this, we will be charting. We need to put in the time and date the patient has expired, the time the patient ceased to breathe, the time that the patient was pronounced dead by the doctor's name and who made the pronouncement, and relatives or kin who received the patient's possession. That would be all. Thank you.